You know the feeling. It's red, it's itchy, sometimes it's goopy, and it's just annoying. Today, we are diving deep and demystifying pink eye. We're going to uncover what's really going on when your eye gets all inflamed, and, maybe more importantly, what you can actually do to make it go away. So, let's kick things off with a little riddle. What do a classroom full of kids, a classic winter cold, and a beautiful field of spring flowers all have in common? It sounds totally random, I know, but they all share one very irritating connection.
And there it is. The answer is conjunctivitis, or as pretty much everyone calls it, pink eye. Yep, each one of those things, kids spreading germs around, the viruses that cause colds, and all that pollen in the air, they're all major triggers for this exact condition.
So here's our game plan. First, we'll tackle what this annoying red eye thing even is. Then we'll line up the usual suspects that cause it. After that, we'll become detectives and learn how to read the clues to tell them apart. Then we'll check out the doctor's battle plan, and finally, we'll talk about your best defense so you can avoid it altogether.
Okay, part 1, the annoying red eye. Before we can really get into what goes wrong, we've got to understand the basics. What are we even dealing with here? So, at its very core, conjunctivitis is simply an inflammation. You see, you have this super thin, clear membrane called the conjunctiva. Think of it like a protective shield that covers the white part of your eyeball and also lines the inside of your eyelids. When that gets inflamed, you've got pink eye.
And this little shield does a ton of work. It's not just sitting there. It keeps your eye lubricated and moist, it physically blocks stuff like dust from getting in, and it even has immune cells to help fight off germs. So you can see why when this shield gets irritated, the trouble starts.
So, what makes this shield so angry? Well, that brings us to section 2. Let's play detective for a minute and round up the usual suspects behind pink eye.
Okay, the causes really fall into two main buckets. On one side, you've got the infectious kind. This is the one caused by germs, bacteria, and viruses that you can actually spread to other people. On the other side, you've got the non-infectious kind, caused by irritants like pollen or chlorine. You can't catch this type from someone. And honestly, this is the most important distinction you can make.
Now, if we look closer at those infectious culprits, you've got bacteria like staph. But, and this is a big one, the main villain is actually a virus. Adenovirus, the same kind of virus that gives you a common cold, is the #1 cause of pink eye. That's a huge clue, right? It totally explains why pink eye seems to sweep through schools and offices right after cold and flu season.
And then, on the non-infectious side, you've got your everyday environmental triggers. The big one is allergic pink eye, set off by stuff like pollen, dust, or pet dander. And then there's the plain old irritant kind, from direct contact with things like chlorine in a swimming pool or a puff of smoke.
All right, so we've met the suspects, but when you wake up with a red eye, how in the world do you know which one you're dealing with? Section 3 is all about that, reading the clues and looking for the unique signatures each one leaves behind.
So the biggest clues are in the symptoms, especially the discharge. If you have this thick yellow or green pus that makes your eyelids feel glued shut in the morning, that is a classic sign of a bacterial infection. But what if it's more watery? Well, then it could be viral or allergic. So here's the tiebreaker. Viral pink eye often feels like a burning sensation, and it is super contagious. The allergic kind, on the other hand, has one main symptom that trumps all others, a really, really intense itch. And just as important, it's not contagious at all.
So just to recap, the bacterial intruder's calling card is that thick, sticky, goopy stuff. If you see that, that's your biggest clue right there.
The viral villain, though, is a different beast. It's all about that watery discharge, and it rarely shows up alone. It's incredibly contagious and often brings along some friends, like a cough, sniffles, or even a fever.
And finally, we've got the allergic agitator. The telltale sign, the one thing you really can't miss, is that maddening, can't stop rubbing it itch. And it's usually in both of your eyes at the same time.
So what's actually happening inside your eye to cause all this? Well, think of it in 4 steps. First, the invader arrives, a virus or maybe just some pollen. Step 2, your body sounds the alarm and triggers an inflammatory response. 3, to fight it off, the tiny blood vessels in your conjunctiva expand to bring in reinforcements. And that leads to step 4, red alert, the red, swollen, and leaky eye that we all recognize. Okay, now that we know the who, what, and why, let's get to the fix. It's time for section 4, the doctor's battle plan. How do we fight back and treat this thing?
The treatment plan has to be tailored to the cause. It is not one size fits all. For bacterial infections, the go-to plan is usually antibiotic eye drops. But for viral infections, well, antibiotics do nothing. So it's all about supportive care, using things like artificial tears for comfort and cold compresses to soothe the eye while your body's immune system does the fighting. And for allergic pink eye, the solution is antihistamine drops and, trying your best to avoid whatever you're allergic to.
But look, what the doctor prescribes is only half the battle. What you do at home is just as critical, both for your own recovery and for making sure you don't give it to everyone around you. So what's your action plan?
Here's your checklist. When you clean your eyes, always be gentle and wipe from the inner corner by your nose out towards your ear. And this is crucial. Use a new, clean cotton ball or cloth for each eye so you don't spread it from one to the other. Wash your hands a lot, like constantly. Don't share anything that touches your face, towels, pillows, makeup, you name it. And if you wear contact lenses, just stop. Switch to your glasses until a doctor gives you the all clear.
This all brings us to our final and maybe most important section, your best defense. How do we just stop pink eye before it even gets a chance to start?
Let's run through the top 5 strategies. Number 1, and this is the big one, is to become a master of hand hygiene. Number 2 is really hard but so important. Stop touching or rubbing your eyes. 3, always use your own towels and pillowcases. 4, if you're a contact lens wearer, be absolutely meticulous about cleaning them properly. And 5, for all you allergy sufferers out there, know your triggers and do your best to avoid them.
Look, when it comes to the infectious types of pink eye, the ones that spread like wildfire through schools and homes, it all comes down to one thing. Good hygiene is your #1 shield. It is the single most effective weapon you have.
And that kind of leaves us with a final thought to chew on. In our world of shared keyboards, doorknobs, and crowded spaces, is perfect eye hygiene more than just good advice? You have to wonder, could it be our most practical, everyday superpower? Something to think about. Thanks for tuning in.